Well, good morning, everyone. I'm Michael McGinnis from the National Academy of Medicine, and it's my distinct pleasure to welcome you to our national conversation on vital directions in health and healthcare. Our conversation today has been prompted by opportunity and by challenge, the opportunity of emerging science, knowledge, and technology, the challenge of underperformance in both health and healthcare, and both the opportunity and challenge of an upcoming transition in administrations. It's clearly a time to take stock of what's possible. Our conversation will be informed by extensive work done by many authorities from around the country, a number of whom are in this room today, and who have worked under the guidance of a steering committee co-chaired by Victor Zhao, the President of the National Academy of Medicine, and Mark McClellan, Director of the Duke-Margolis Center for Health Policy at Duke University, and former Administrator of CMS and Commissioner of the Food and Drug Administration. In a moment, I'll turn the podium over to Dr. McClellan to review in more detail the motivation for the Vital Directions initiative. But first, a quick overview of the materials you've received and the flow of the agenda. As to materials, the papers developed by more than 100 experts have been posted in pre-publication form on the National Academy of Medicine website, along with their recommended vital directions. In addition, today, I think at 6 a.m. this morning, the Journal of the American Medical Association, JAMA, has released online viewpoints for each of the 19 papers, also with comments from two editorialists, David Naylor and Howard Koh, who is here today. You've received booklets with a hard copy of each of the JAMA viewpoints, and the two editorials are being reproduced now and will be available shortly in the vestibule outside. It's important to emphasize that as extensive as this work has been, it's still a work in progress. Today's conversation and other comments will inform any additional edits that might be made to the pre-publication versions of the 19 papers, and it will also inform the synthesis paper to be developed by the steering committee and released later in the fall. Now let's turn to the briefing booklet that you received today, which contains the steering committee roster, the agenda, a description of the initiative, the focus areas, paper titles, authors, and summary recommendations for vital directions, as well as the biographies of the steering committee and today's speakers. As to the agenda flow, after Dr. McClellan and Dr. Zhao have reviewed the rationale and the framework for the initiative, 3 moderated panels of distinguished national authorities will consider, respectively, the opportunities for better care, strong science, and better health. The aim set out by the steering committee is for panel comments to be relatively concise, so that almost half the time is reserved for broad interaction. At the end of the day, the 3 panel moderators, Sheila Burke, Meg Gaines, and Ellen Leshner, will offer summary remarks, and the meeting will then be wrapped up with closing remarks from Dr. McClellan and Dr. Zhao. So we anticipate a day that is most informative, productive, and vital for the health of the American people. Thank you again for participating, and please join me in welcoming Mark McClellan to the podium to start us off.